We will discuss today the scapular region. This is the prone position of the body, and this is head and neck, and this is the shoulder region. So we will discuss about the scapular region, and we will keep the incision from the neck over the external occipital protuberance to the midline incision till up to the T12 thoracic vertebra, and we will keep the horizontal incision over it, and we have reflected the skin of the scapular region. Along with it, I have reflected the deep fascia and superficial fascia. After that, you can see this is the trapezius. Trapezius, it is a rhomboid in shape, and here it is this part of the head and neck part of the trapezius we have not reflected, but we cut the trapezius from the midline, and we have reflected the trapezius, as well as we have reflected this is the spine of the scapula, this is the medial border of the scapula, this is the lateral border of the scapula, this is the infraspinatus fossa, this is the supraspinatus fossa, this medial border. Now, first of all, we have reflected the trapezius to cut the medial border of the trapezius. We have not reflected the part of the head and neck region of the trapezius, but reflect the shoulder region. Here, this portion, upper part of the spine, also there is attachment of the trapezius muscles, and the lower part, here you can see this lower part, which is there is a attachment of the lower part of the spine of the scapula. On the back side there is a attachment of the deltoid muscles. Here you can see this is the spine, this one is the spine of the scapula, this is acromion process. Here you can see this is the acromion process. Here this lower lip, there is attachment of the deltoid, this is the lower lip, there is attachment of the deltoid, as well as inside the infraspinatus, this is the infraspinatus muscles. Inside the supraspinatus fossa, this is the supraspinatus muscles. Here in this area there is a supraspinatus. On the upper aspect, this spine, there is a attachment of the trapezius muscles. This area there is a upper lip of the spine, there is attachment of the trapezius, and now I reflect this trapezius muscles, as well as I have reflected the lower lip attachment of the deltoid muscles. And you can see here the muscles after reflecting this trapezius. Here you can see this is a spinal accessory nerve which is innervate to the trapezius muscles, as well as it is the 11th cranial nerve, and these are the blood vessels which is branches of the subclavian which is supplies to the trapezius muscles. On the medial border, on the dorsal aspect, there are three muscles which is attached. On the lower aspect, on the medial border of the scapula, on the dorsal aspect, this muscle, it is called the rhomboids major. At the level of the root of the spine, here at that level there is a muscles which is attached, it is the rhomboids minor, and these muscles on the upper aspect of the dorsal aspect of the medial border, there is attachment of the levator scapulae muscles. Now I will reflect these two muscles. I have cut this medial attachment of the rhomboids minor and rhomboids major, and here at the upper border of this rhomboids minor, here you can see there are blood vessels and nerves which is innervating to the rhomboids major and minor. This is the nerve to rhomboids. It is the branch of the root of the C5 which gives the branches to the rhomboids major and minor, and along with it there is on the medial border of the scapula there is a blood vessels. It is called the deep branch of the transverse cervical. It is the branch of thyrocervical, and it is coming from the subclavian artery. So here you can see this is the deep branch of transverse cervical artery. Along with it there is This is the now to rhomboids, which is attached now to rhomboids, which is coming from the C5 root, and it supplies to the rhomboids minor and rhomboids major muscles. After that, I have reflected here. I have cut the supraspinatus muscles from the medial aspect, as well as there is a on the around to the spine. I have reflected this supraspinatus muscles, and here you can see there is a vessels. Here you can see this is the vessels. Here you can see there is a, after reflecting this supraspinatus muscles, you can see these vessels. It is a suprascapular vessels, and deep to it there is a one nerve. This is a suprascapular nerve, and here you can see there is a one suprascapular from the notch. It is converted into the foramen by the. I have already reflected the supraspinatus, and here you can see this is the suprascapular vessels. This is a vein and artery, and on the lower aspect here you can see this is a suprascapular nerve, and the suprascapular notch at this level, which is converted into the foramen by the suprascapular ligament, and below it passes the nerve, and above to it there is a passes the suprascapular vessels. So above you can see this is a vein and artery which is passes, and below it is passes the suprascapular nerve. So this suprascapular nerve, which is a branch of the upper trunk, and it is innervate to the supraspinatus muscles, as well as it supplies to the infraspinatus muscles. After passing these suprascapular vessels through the suprascapular notch, vessels which is passes from the upper side, and the nerves which is through the passes, it come into the spinoglenoid notch, and it enter into the infraspinatus fossa. So I have reflected the infraspinatus, and here you can through spinoglenoid notch you can see these are the vessels. Here you can see artery, nerve, and veins, all three, which is goes inside the infraspinatus. So suprascapular nerve, it is a branch of upper trunk which is coming on the back sides through the nerve which is passes through the suprascapular notch deep to the suprascapular ligament and vessels which is passes from the upper sides, and after this passing it is enter into the between the spine and glenoid cavity. It is called the spinoglenoid notch, and it enter into the infraspinatus, and it supplies to the blood and vessels, and nerves also supplies to the infraspinatus muscles. So this is about to the muscles of the scapular region. This is the infraspinatus, this is the supraspinatus, this is the rhomboids major, this is the rhomboids minor, this is the levator scapulae, and here you can see this is the trapezius muscles. I already show you these are the deep branch of the transverse cervical along with the nerve to rhomboids. Here you can see this is the nerve to rhomboids. Now we will discuss about the spaces of the scapular region. Now we will discuss about the spaces around to the scapular region. This is the infraspinatus muscles. Along with it, this is the teres minor muscles, and here you can see this is the teres major muscles, and the portion of the latissimus dorsi, because of the overstretch, it is a fiber which is rupture or tear. Here you can see, but this is the upper triangular space, and this teres major which is goes on the front side, and the teres minor which is remain on the back side. Over the greater tubercle there is an insertion of teres minor, and which is arise from the dorsal surface of the lateral border of the scapula, and the teres major which is arise from the also lower portion of the dorsal scapular of the lateral border of the scapula. There is a attachment of the teres major, but the teres major which is goes on the front sides, and it is attached to the medial lip of the bicipital groove. There is a insertion, and the teres minor which is retained on the back side, and it is inserted on the lower margin of the greater tubercle of the humerus, and here in between these two there is a one vessels. It is the circumflex scapular artery and veins. Here you can see which are the content, and it is the upper triangular space which is bounded by above by the teres minor, below by the teres major, and laterally it is bounded by the long head of triceps muscles. This is the long head of triceps. So this triangular space, it is called the upper triangular space, and it contains the circumflex scapular artery, and it is a branch of the subscapular artery. It is a subscapular, it is also a branch of the third part of the axillary artery. Now we will discuss about the quadrangular space. This is the quadrangular space, and it contains the axillary nerve and posterior circumflex humeral artery. Here you can see this is the axillary nerve and this is a posterior circumflex humeral artery. Both of them which is bounded by the above bounded by the teres minor on the back side. On the front side there is a anteriorly subscapularis muscles, and below it is bounded by the teres major muscles. Medially it is bounded by the long head of triceps, and laterally it is bounded by the shaft of the humerus. And this quadrangular space, it contains the axillary nerve, and this axillary nerve which mainly supplies to the deltoid. Here you can see these branches goes to the deltoid, and posterior circumflex humeral artery and veins both are which is lies inside the quadrangular space. Now we can see this is the lower triangular space, and this lower triangular space which is above, which is bounded by the teres major, and medially it is bounded by the long head of triceps, and laterally by the shaft of humerus. This is the shaft of humerus, you can see here. And this inside there is a nerve, it is the radial nerve along with the larger branch of the brachial artery. It is the profunda brachii artery which is lies inside the lower triangular space. So medially it is bounded by the long head of triceps, laterally it is bounded by the shaft of the humerus upper part, and the above it is bounded by the teres major muscles. So this is the lower triangular space. So this is, I hope you enjoy the all the muscles of the scapular region. Here you can see this is a latissimus dorsi which is also supplied by the nerve to latissimus dorsi. It is a branch of the posterior cord which innervate, but you can see from the front sides. This is the teres major which is supplied by the lower subscapular. It is also a branch of the posterior cord. Triceps which is supplied by the radial nerve. Deltoid which is supplied by the axillary nerve, and also teres minor which is innervated by the posterior division of the axillary nerve. And this posterior division of axillary nerve, there is a pseudoganglion which is the actual not ganglion, but it is a look like ganglion. That's why it is called the pseudoganglion, which is supplies the posterior branch of the axillary nerve. It is there is a supplies to the teres minor and have a pseudoganglion. Infraspinatus and supraspinatus, which is supplied by the suprascapular vessels and nerves. Here we already suprascapular nerve, it is a branch of the upper trunk. Nerve to rhomboids major and minor, which is innervated by the nerve to rhomboids. This is the branch of the C5 root, and the nerve to levator scapulae, which is also fibers have from the C5. It is supplies. And now to trapezius muscles, which is innervated by the spinal accessory nerve. So hope you enjoy the muscles of the back of the shoulder region and the scapular spaces. Thank you very much.